Hello, I'm Dr. Chen from SL Aesthetic Clinic. Today I'm going to introduce you to one of our non-invasive skin lifting and tightening treatment called Ultraformer MPT for your skin concerns. So at SL Aesthetic Clinic, we always value customizing the treatment protocol and personalizing it to our patients' needs so they can achieve the best results. So let's take a look at our patient today. Now, if you look at your face, you can see there's mainly a lot of this sagging and a bit of signs of aging that we can see here. So at the upper face, we can see a little bit of these fine lines in the forehead area, a bit of a droop in the brows as well as the upper eyelids. So with this Ultraformer MPT treatment, what we can do is to lift the upper face and really help to lift the brows and upper eyelids and tighten it. And the lower face area, we can see quite a lot of heaviness and sagging in this mid-cheek area, resulting in the prominence of laugh lines as well as marionette lines in the lower cheek area. And there's also a bit of this heaviness in this jowl area, and that causes the laugh line and the marionette line to look a little bit heavier and saggier, as well as the blunting of that jawline. So what we can do is to really do a deep lifting of the SMAS, which is the muscular layer, to help to lift up this mid-cheek area and the jawline area, as well as to use the machine to burn a bit of the fats and excess tissue in the lower jaw area and the double chin area to really help to give that kind of jawline definition. So the unique thing about Ultraformer MPT is that we have different handpieces of varying depths so that we can target the different layers accordingly. So for example, for our patient here, I'm going to start with a deep lifting of the SMAS layer, which is the muscular layer. So I'm going to start with the 4.5 mm. As you can see, it is a very fast treatment and with minimal discomfort. Do you feel any pain? Oh, good. So the way we deliver the shots is also important. So for this patient, we can see earlier on that she has quite a lot of jowling and sagginess, especially focused on the lower area. So I'm going to focus a lot of my shots on this area, as well as I will do a kind of a vector kind of way to deliver the shot so that it really can help to tighten the sagging. So for most patients with who struggling with double chin issues, generally it's a combination of different factors. Number one is the prominence of soft tissue and fatty tissue, and the second is that of skin laxity. So for Ultraformer MPT, the unique thing and the good thing is that we have a 6.0 mm handpiece, which can actually, the transducer can actually target the shots to a much deeper layer to really target the fat cells and have a bit of fat reduction. So I'm going to try that for her double chin. So next I'm going to work on the periorbital area. So for the periorbital and also the forehead area, most of the time the issue is that the skin is really thin and we don't need something that goes too deep. So what I like about Ultraformer MPT is that there's actually one of the transducer that goes to about only 2.0 mm, which is the right depth so that because if it's too deep, you actually hit the bone directly. And also the transducer head actually is very, very narrow. So actually we can really go around the contours, around the eyes, as well as the forehead very effectively. So we really can target the area around the eyes, the crow's feet, as well as to go on to the brow and a little bit of the upper eyelid to achieve that eyelid lift in a very fast, effective, precise and comfortable manner. So actually within maybe like 10 minutes, I already completed this side of the cheeks, and already you can start to see a bit of tightening and lifting. So let me show you. Come, take a look. So compared to the other side of the cheeks, actually this side already looks more lifted and actually a bit slimmer and more V-shaped. So the next thing, after tightening the deep layer of the skin, the next part I'm going to do is to really target the subcutaneous and the fatty tissue layer. So what I'm going to do is to use the 3.0 mm handpiece to help to reduce some of the fats. Okay. So likewise, I'm going to focus a lot on the lower part of the face, or the cheek area, because this is the part that's the heaviest, as well as a little bit maybe on near to the laugh line area. So finally for her, I'm going to add on just a few more shots with the 1.5 mm transducer. So 1.5 mm really targets the superficial layer of the skin, and for her I do that because I can see some of her enlarged pores as well as a little bit of acne scars in certain areas, especially around the temple area as well as this cheek area. So with this 1.5 mm actually can help to do a little bit of the surface of the skin, and that can help to improve a little bit of the pores, the texture, as well as the acne scars, and also the fine lines. So it's really fast and quite comfortable, right? Yeah. So I'll focus a little bit more on the scar area, like this part. Okay, and so in about maybe less than 30 minutes, we have completed the whole treatment today for her full face and the jawline area for Ultraformer MPT. And now you can look at the mirror. Actually, there's minimal downtime, there's minimal redness, and you can continue with all your activities as per normal, and we await the results for the lift.